think we're going to get started here. Thank you everyone for coming, and we will do our best to be heard over the children playing in the fountain. Today we wanted to get together and talk about a very challenging issue for our city. We know we have many, and we know that they're all connected in a lot of ways to our first responding efforts and in many ways to our 911 system. Today we're going to outline and articulate the challenges that we're having with respect to 911 call volume, but also talk about some of the solutions we have in many ways to sort of stop the bleeding in many ways in terms of this challenge that in many ways is also a reflection of all these underlying issues that we've been talking about, whether it's things like addiction, whether it's things like poverty or even aging, even some of our housing stock. There's all sorts of root causes. We see this way on the other end in our 911 call volume. And so today we're going to talk about a few different aspects of that. So let me begin by just acknowledging a few folks, some of which are going to share a few words with you. Our Chief of AFR, Chief Dow, is here with us. Our County Manager, Julie Morgus-Baca, also here clapping. Thank you. And our Family and Community Services Director, Carol Pierce, and Selena Lopez and Rob Nelson from APD, from Coast. Now we also have some other folks here who we'll introduce in a little bit. But I want to share with you initially that as we address crime from all sides in Albuquerque, all sides literally means all sides. And so that means trying to work on things on the front end of these challenges, but also on the back end and dealing with our 911 call volume and trying to support our first responders as they take these calls. And you know, when I came into office, I met with our fire department and we did something very unique. We actually worked with them on a strategic plan for the next 4 years. And that was actually presented by the department up to the executive team. And our CAO, who's also here, Sarita Nair, and I reviewed that, and we approved a lot of different programs that are now coming to fruition. And you know, they can't come soon enough because this is a real challenge for our city. And similarly to the police department, I know we've talked a lot about the challenges they have with respect to maintaining adequate resources, getting the staffing that they need. We also see this in AFR. And we see this in many ways, just like we have SWAT calls that are being responded to by APD. We have similar units that play a similar role also at AFR, and they also need adequate resources and staffing help as well. So for us, we want to acknowledge that the fire department has its own challenges. And our city also, as we know, is unfortunately stricken with addiction challenges. And that shows up in 13,000 overdoses a year before we took office. And that's a little more than 35 overdoses a day happening in our city. And I want to acknowledge the graphs and charts here that the chief is going to go into. But as you can see, similar to what we see on the APD side, this has been a steady rise over the last decade in these challenges. And so we are continuing to see, hopefully, a tapering off and hopefully eventually that curve going the other direction. And so for us, one of our first moves was to restructure the fire department. Now, of course, as we call it, AFR. And so that meant a completely new management team. It also meant a different organizational structure. And it's one that's designed to reflect the fact that 87% of the calls that come into AFR are actually not directly about a fire. They're about all of these other things. This is the reality today in a lot of cities, but especially ours. And so in order for us to address many of these issues, it even involved things like restructuring the fire marshal's office and how we deal with condemning buildings and doing inspections that often can be used for drug houses and things like that. It also means creating an entire department around our first woman deputy chief, Emily Armijo, who is in charge of a number of these issues, and who will be available after to take your questions. So at a high level, I want to talk about really three short things. The HEART program, which we've mentioned before. This is what our deputy chief is really working on to prevent people from having to call 911. So it's a 911 essentially diversion or prevention program that we'll speak about in a little bit. Then we also instituted our 244 fire program, which is our non-emergency number for fire. We also have a down and out program. This has been a big challenge. No longer do we hope to see both a police car and a fire truck and a paramedic truck at a down and out situation. If 911 triages that appropriately, it should just be our BLS program, which is a paramedic and sometimes a social worker designed to help that individual and hopefully also avoid the emergency room or jail, which was previously the only places we could really take them. And some of this also has to do with keeping our homeless shelter open year round. So this is the first year we're doing that, and we're doing that now in partnership with UNMH, and we have Dr. Voss here as well, who is now this week providing some medical services out there for the first time in our city's history. That is all part of trying to deal with the issues that I mentioned before. Lastly, in our 2020 budget, which we just signed last night, we have investment in all of these programs, and also the COAST program, which is part of our Crisis Those in Need intervention program on the APD side, which we're going to hear a little bit more about shortly. So through our operating budget, through our capital budget, and I think through a demonstration of leadership prioritizing these initiatives, we believe these are going to complement all of the things we're doing across the city to try and deal with what we're seeing that comes in through the 911 door each and every day. So to go into more detail on each one of these programs, we're going to start with the Chief of AFR, Chief Paul Dow. Chief?
All right, thank you so much. I want to talk about, first off, I want to thank the mayor and the CAO, other city departments as well that are helping us to curb this challenge that we have in Albuquerque Fire Rescue. Like the mayor said, this didn't happen overnight. You can see the charts here, and the call volume has been steadily rising over the last decade. A lot of the data that I have from 2013 to 2018 shows a 35% increase in the calls that our firefighters are responding to every year. And it's actually a 51% increase from 2005. But from 2013 to 2018, we've had stabbings and shootings go up 70%, assaults go up 31%, overdoses up 14%, traumatic injuries up 53%, down and outs, like the mayor talked about, up 135%. Structure fires in this city are actually up 22%, and that is against the national trend, which is going downward in most parts of the country, and we're going up. Outside fires gone up 83%, and we're averaging almost a car fire a day. So the results of an increased call volume in Albuquerque is that additional calls for service means there's less apparatus on the street to actually respond to those emergencies. So many times there's an out-of-district apparatus that has to respond to another district and to respond to that call. That extends that response time for them. That happens about 12% of the time, that when a station has to respond into another station. This is including when we've added 2 ALS rescues over the last few years. So Rescue 2 in 2014, Rescue 4 in 2017, and our response times have still gone up. In fact, from 2013 to 2018, you can see it's gone up 52 seconds in that period of time. So just how busy is an Albuquerque firefighter, you may ask? Basically, we are busier than most other Southwest cities, even cities that are larger than Albuquerque. From the charts over here, El Paso, which has 34 fire stations, runs about 78,000 calls a year. Oklahoma City, which is a bigger city as well, 37 fire stations. They're running about 75,000 calls a year. And then we also beat Tucson and Colorado Springs in our call volume. If you also look at it, the entire state of New Mexico, Albuquerque Fire Rescue runs more calls than the entire state of New Mexico combined. The next closest department runs less than 19,000 calls a year. That's absolutely impressive what our firefighters are doing with the staffing and the resources that they have. A third party, the Commission on Fire Accreditation International, has identified that 3,850 calls per single apparatus per year is the 110% threshold. So if you exceed that 110% threshold, basically you're on calls so many times you're not available for calls in your area. It's time to add apparatus, add resources at that point. The more calls a fire apparatus responds to, the less often they are available for other calls in district, and therefore apparatus in responding or surrounding districts have to respond to their area. 12% of our responses are into surrounding fire stations, and again, we have 10 apparatus that are above the 110% threshold. We have 8 apparatus within 100%, and we have 4 apparatus within that 100 calls of the 100%. So that means half of my engines and rescues are right there at that 100%, 110% threshold. They can't really take any more calls. It's affecting the service that we can deliver. Now, when firefighters are not on calls, They are doing additional training. In fact, firefighters typically work on a 56-hour work week, 2,900 hours a year. 10% of that time, almost 300 hours a year, are dedicated to training. EMS training is anywhere from 20 to 30 hours. Our ISO training, Insurance Service Office training for firefighters, requires that we train each firefighter with 210 hours every year. Special ops, hazardous materials, flood channel rescues, heavy technical rescue, wildland training, all of that adds up. And that's what our firefighters are training on every single year. Hydrant inspections. There are over 16,000 hydrants in the city of Albuquerque, and my firefighters check those every single year. They put their hands on every single one of those hydrants to make sure that they're operating as they should. We do open space patrols in the Bosque, in the foothills, in the West Mesa. We offer community risk reduction programs to the community. We do lifesaver training, hands-only CPR, station tours. We visit schools. We maintain our apparatus, our equipment, our firehouse, and all the property that surrounds it. What our firefighters do on a regular basis is absolutely phenomenal, and they meet that call volume demand every single time. Now, there's only two solutions to lower the annual calls per apparatus and improve our response time. We can increase the number and availability of apparatus, which I'll talk about, or we can reduce the number of 911 calls. So some ways that we've actually increased the number and availability of apparatus. Just like the mayor said, we implemented the BLS rescue program. We have 3 teams that are operating on 2 rescues 7 days a week right now. They just started this with the 2 rescues last week, and already we're averaging 10 calls a day for those trucks. We now have firefighters that perform their physicals off duty. Every year, firefighters are required by NFPA and OSHA to get an annual physical. We used to do that on shift, and that took them out of service. For 2 firefighters to get it done, it was 3.5 hours. Now they do that off duty, and it keeps those trucks in service. We did the same thing with EMS training. ISO requires we do 2 days of suppression training. Now we can take one of those EMS days that was dedicated to training on duty, and that's done off duty for our paramedics. It keeps more trucks in service throughout the day. We couldn't add another training day. There's just not enough days in the year for us to do that with the amount of training that they have. We also have a new fleet preventative maintenance program. So when we get our new fleet facility, which we just executed a purchase agreement for a new facility on the west side, which is close to our training academy, we'll have a drop program. Just like I said, the firefighters train an awful lot throughout the year. They simply drop off that apparatus when it's already out of service for training. It gets the repairs and the maintenance that it needs. By the time they're done with training, they go back into service in a truck that's got oil changed, new tires, and it's fixed appropriately. Now, solution 2 is to reduce the number of 911 calls to 911. Like the mayor said, the HEART program has been an absolute success. We have over 80 patients in the system right now, and we've significantly decreased the reliance on 911. We're also working with other city departments and community groups to decrease the number of reliance on 911. This year in the FY20 budget, we have a new fall prevention program in the HEART program. So we had 8,700 falls last year. We identified that 70% of those falls were people that were 60 years and older. So we partnered with the Department of Senior Affairs. We have a more proactive approach to actually address those falls and those issues. We now have a new community risk reduction division as well. That's over here. We have a captain, a lieutenant, and 2 drivers, and they're dedicated to providing lifesaver training, hands-only CPR training. They're doing recruitment. They're doing public education programs. We have almost 30 public education programs that we offer this community. We also have a new risk assessment position. So one of the drivers that's assigned here, Driver Shum, he's actually teamed up with APD, and they do risk assessments and threat assessments. They'll do that on commercial buildings, schools, and churches, and it's really for active shooter situations. We teach them how to harden that facility. We train the people that operate in that facility so that they are better prepared if there is an active shooter incident. In 2019 so far, Driver Shum has actually completed 30 buildings so far, which affects over 30,000 residents in the city of Albuquerque with the training and the information that he's provided. We also have a new non-emergency number. It's 244-FIRE. You can get information about records management, fire marshal's office, open burn line as well. So we also have changes to the type and number of apparatus we dispatch. We looked at all the fire and medical responses, and we reevaluated with the staff and our medical director to find what can we do better. Are we sending too many apparatus to some incidents and not enough to others? So we streamlined that, and we've made it a more efficient process. We have several new PSAs. One of them actually is regarding down and outs. We're asking the public, if you see someone sleeping in the park or off on the side of the street, please make sure that if you do feel it's appropriate to call 911, that you're giving as much information as possible so we send the appropriate resource. However, understand, many times those people sleeping in the park, they don't want help. They're simply just sleeping there. So we want to get more information out about that to the public as well. Other PSAs we have coming in the future are sick calls. So that's the #1 call that we responded to last year, over 12,000 sick calls in the city of Albuquerque. We want to make sure the public understands that just because you arrive at the hospital in an ambulance, it doesn't mean you'll get seen by a doctor any sooner. You're going to be triaged at the hospital in the emergency room, and it doesn't mean you're going to get seen any faster. So there's a misconception out there. If I call 911 and the ambulance takes me, I'll get seen by a doctor a lot sooner. That is not necessarily the case. Now, while all of that, we're facing significant challenges in this department. Our demands to our firefighters are insurmountable. But together as a community, as one Albuquerque, we can decrease our call volume, improve response times to life-threatening calls. Our Albuquerque firefighters continue to meet these challenges each and every day. And I'm extremely proud of the work that they do. And myself, along with IF Local 244 membership, will continue to advocate for their safety and well-being, because we're firefighters and we never stop.
So I think the only statistic that the chief left off, which he can source it, but if you take the amount of work that he just described and divided it by our population, we have the highest pound for pound, or most productive pound for person for population. It's a boxing reference for those of you. We punch way above our weight, harder than any other department in the country. So this is, no matter how you look at it, the busiest department in the United States of America for a major city based on per population. Okay, now also helping out in this effort are some efforts from our Family and Community Services team, and to talk about that, our director, Carol Pierce.
Thank you so much. I think everyone here realizes one of our top priorities of this administration is to address the needs of our homeless people that are here in Albuquerque. And to start with, and the mayor mentioned this, we're very proud as a community that for the first time in our city's history, we did not close our West Side Emergency Housing Center on March 15th. Typically in the past, it was open November 15th to March 15th, the coldest time of the year. This year, we did not close on March 15th. We are open now 365 days a year. We are open 24 hours on the weekend, and we are also providing food. We could not do this without partnerships, and very strong partnerships. And I'd first like to acknowledge Julie Morgas-Baca from the county, our county manager. As the city takes a lead on homelessness and the county takes a lead on behavioral health issues, we came together to see how can we work together. So with the county's support, we now have case managers available out at our West Side facility that are there to begin addressing the needs of our folks that are out there. And in addition, they are providing resources because it's expensive to provide the transportation back and forth. Our facility is 20 miles outside of town, and with the support of the county, we are able to add more pickup sites for the buses that take people out to the West Side. We were soon able to see in the true one Albuquerque fashion the need, how we needed to work together and reduce the number of 911 calls that were happening and pulling fire and EMS rescue first responders out of service to respond of needs out at our West Side Emergency Housing Center. It was then we went to our partners at UNM HSC, and I'd like to acknowledge that we have Lindsay Fox here today from UNM, from the Department of Family Practice and Community Services. Here today, we went to UNM and said, how can you help us? So I am very excited to say now for a month, we have had our partners from UNM there on Monday and Thursday evenings beginning to provide care, to connect people with resources, to find out, we want to address the immediate need to see if a 911 call is really indicated, or can we address the immediate need and then get people connected to services and beyond. We've built out a modest medical exam rooms out at our West Side facility, and we now have new offices for case management and other community partners that will be joining us. This is just the beginning. We are very excited that Presbyterian Healthcare Services, along with Loveless Medical Center, we've had preliminary conversations with them. They want to join this partnership with the other health providers. Our goal is to have health services out there on every evening of the week and on the weekends to really, again, connect people to services and reduce the 911 calls. But this is us as one Albuquerque and as a community working together. Thank you.
And we're going to close with a little bit from APD's Coast team in their outreach efforts. Selena Lopez?
Hello, just a little bit about Coast. We've been around. Sorry about that. Coast has been around since 2006, and kind of similar to the HEART program and what Family and Community Services were saying about the homeless population. We get together, we respond to officers that are out on the field when they encounter somebody that might be in a behavioral health crisis. They'll respond to them. If it's not criminal, they'll call Coast out, and what we try to do is a needs assessment and see kind of what kind of services we can link them up to. If it's drug addiction, if it's homelessness, if it's behavioral health, we'll try to link them up to those kind of services. We do follow up. We have clinicians and psychiatrists that work within our unit along with the detectives and the co-specialist, and we will do follow-up in their homes or out on the streets and try to just link them up to the appropriate agencies that might help them with those type of needs. And like I said, we're just part of the community, just trying to all work together with one Albuquerque and out for the same mission. Thanks.
Okay, and we added additional funding to expand the Coast efforts. And so the other piece that we're trying to showcase a little bit in our budget is investing in what has been a very successful program for a long time. What we need is more of the Coast team. So hopefully now we'll be able to do that with this funding. Okay, so with that, we're going to wrap things up. Each department or respective folks will be around for questions after. And let me just say I want to thank everyone's efforts, from the fire department to Family and Community Services to APD, just for all you do for our city, and also for working together, and our administrative leadership with our CAO, Sarita Nair, for helping us implement the strategies and the vision that we set out on last year. Thank you so much.